Best, she packs good stuff. And millions of people who suffer from chronic debilitating headaches called migraines, well, the pain can last for hours, as you know, even days. A pain center right here in South Florida now is part of a nationwide study to see if a successful treatment for your back pain could also help your brain. Almost every day, 40-year-old Gina Selwitz had the throbbing pain of a migraine headache.
I would miss work. I was in bed most of the time, depressing. It's just very depressed.
Shows up around T8.
To help Gina, Dr. Michael Schou is using nerve stimulation, a procedure that's already proven to relieve back pain. Here, electrodes are placed right along the spinal cord. Then, an implanted stimulator blocks pain signals from the nerves to the brain.
That cuts off the pain signal and sends a little tingling sensation up to the brain. So your pain is no more there.
Bernice Fugate tried spinal cord stimulation when all else failed to relieve her back pain.
It's amazing. It's helped me cut back on the amount of medication that I have to take. I'm so glad that I did it.
Now doctors are seeing this concept for the brain. Gina is one of the first patients. 15 sites around the country will be taking part in this particular study. The surgery itself only takes about an hour. The whole idea to short-circuit the nerves right here in the base of the skull that fire and start a migraine so that patients hopefully don't ever have that headache at all.
They used to have migraines 2 or 3 or 4 times a week. I mean, incapacitating. I can't go to work migraines. To the point where these people are back to work and they may or may not have one a month.
Electrodes are now implanted in the base of Gina's skull. With fewer migraines, Gina is much more active and alive.
Before, if I went to a dance or I went out, the music would just kill my ears and I'd have to stand outside or go somewhere else. Now I can actually participate in dancing and going out and doing different things and not worry about the noise.
Doctors hope to have FDA approval and insurance coverage as soon as possible. And migraine headaches, too, have a genetic component, it seems. Another study of twins showed a 60 to 65% genetic propensity for developing migraines. Doctors hope, again, to have this FDA approval, which would then lead to insurance coverage, hopefully by the end of the year. And if you're interested, this is taking place at North Shore Medical Center and the Pain Center there.
And that really is a big deal because so many people suffer from migraines, and a lot of the time there's not a lot that they can do about it.
No, sometimes medication really doesn't work. We're talking about the kind of migraines that really begin back here in the base of the skull, not necessarily the ones where the auras are seen or that kind of thing. So it's a certain kind of migraine patient.
Such medical terms, Christy. You got to simplify it for us.
Base of the skull.
Okay, thank you.
I sound very doctory.
Yes, you do. Appreciate that.
Yes, Christy.
Good day, Christy.